So I'm Ali Ward-Head and I'm now a clinical commissioner for Derbyshire CCGs. I think when I came to your CTR, which is where we met, I was an independent clinician on the panel and I wasn't working completely as a commissioner. But
I think you might have been the clinical lead on the first one, and then on the second one you came as commissioner. You were officially a member of the commission, yeah.
And you are?
My name's Thomas. I'm a service user. I've had 2 CTRs now and some history before that.
Yeah. So I think the next thing that would be really, really useful for people to know is how come you ended up having care and treatment reviews?
So through my life since I was 15, I've been admitted to acute wards. So even as an adolescent, as a child and adolescent patient, I was admitted to adult acute wards, and over the years racked up quite a lot, turned to what they call a revolving door patient. So I'd be in and out for stays between a month and a couple of years, and then progressively with self-harm and things deteriorating, I ended up doing quite a long placement of 2 years. I did 2 years detained against my will, and that was because the self-harm was leading to accidental suicide, was of a risk of being accidentally suicide. And whilst I was on that placement, they sent off a referral for the autistic spectrum, which I completely forgot about, and it was many years later after I'd moved area and I was in an open rehab, I got the diagnosis of ASD, and then after that, every time that I got admitted to hospital or detained into an acute ward, it would trigger a CTR, and that's where we've met twice.
So before, just out of interest, and I know you've told me these things before, but what diagnosis were you carrying with you in your teenage years?
Early on, I was put through the youth justice system.
So were you getting into a load of bother with that?
All the time, yeah. Different things to do with, say, I've got quite a few possession of bladed article charges, and I worked as a chef. That was my first career. I just got head over heels and fell in love with food. And as a young teenager, I'd take the knives that I used for work out of the house to self-harm, and then authorities had been raised about that I'd got that.
So you weren't getting done for crimes against others. You were self-harming with knives and then getting
once I'd been picked up, there wasn't the 136s that you get as an adult and detained for assessment. I was put through the courts, and then I had a childhood like anybody else. It just seemed that I'd always had these urges and these thoughts and emotions that I'd struggle with differently. And also the way that I learnt was different. School never really applied to me. I couldn't learn. Went into vocational training instead of going to school, and I learnt my career. I learnt to be a chef, and managed to juggle that quite well between being poorly and having a career. Yeah,
just so people kind of have a sense of what that was like for you.
Yeah.
Were people diagnosing you with something? Or?
Well, personality disorder's always been sort of an overhang. Borderline personality disorder, and then...
And did that mean anything to you?
No, it's not till more recent years, more into my adulthood, that I ever paid attention to it. To that, it was just another part of life. Sometimes you might see it as a bit of fun, something that other people aren't doing, and I don't know, maybe a badge of honour at times. And I didn't understand it, and I still don't fully understand it today. And on different admissions, there'd be admissions for different reasons, and it touched base with bipolar diagnoses, and we ended up flipping through the whole chart as if I was playing bingo.
Did you? I wondered if you'd attracted a few.
Yeah.
So you had borderline personality disorder?
Yeah, psychosis, people have questioned schizophrenia before, and PD's always been the one that's sort of settled. I think.
And do you understand why they would have given you that?
Because I've always been a very complex person, but I've always been a very complex case. There was no set symptoms to anyone.
No.
Nobody wants to really put a diagnosis on a child, I don't think.
No. So it took a while anyway.
Yeah. So it took until I passed 18, and then that's when I seriously started getting involved with the inpatient services as an adult, and then the early intervention team come into place. I did my full 3 years with the early intervention team.
Right, and that's because they were suspecting psychosis?
Indeed, yeah, and I was medicated for that on antipsychotics for a very, very long time. So that's where they were sort of juggling where they wanted to be with things, and it's when I went and did my 2 years detained that was at the end of the early intervention.
So that you did stay out under the early intervention team for quite a while, did
Well,
you?
yeah, I had
brief stays in and out.
Like brief acute stays, you know what I mean. But we'd always work on getting back into the community, and it was only after a couple of there was some really risky incidents, some particularly risky incidents that nearly took my life. And I think I'm into the private sector, and unfortunately whilst I was in there, you can only do 3 years with the early intervention. So I went to assertive outreach, which by the end of the 2 years they were trying to get me released, get me took off my section, integrate me back. And then as I got released, the assertive outreach, he got promoted. So then I went to the community mental health team, to a locum CPN, and I didn't find that particularly helpful.
You kept going until you could get a consistent person.
Yeah, and then once you get that consistent person, I don't think that, don't relinquish it is easy. Although it being a therapeutic relationship, a professional one, still fight your corner with them, because they know how you work. It takes a very long time to build a rapport with somebody, where it's very difficult for somebody you don't know to come in a room and ask you to open your Pandora's box and talk about your innermost feelings that you don't understand yourself. It takes time to work that, and then to whip that from somebody's feet instantly.
And I'm guessing that this is just a guess, that you're needing a relationship where someone can actually challenge you as well.
Of course,
so you've got to trust them enough to allow them to do what they might need to do with you when you're
it's just
not
like
doing the right
it's just like having a good friend.
Yeah.
You need somebody that will support you, but at the same time will
tell you the truth.
Yeah, kick you up the backside when you need to. That tell you when you are wrong. But somebody that you trust their opinion enough to be able to do that. Yeah, to be able to take that on board and say, you know what, actually, if you're saying that, then fair play. I'll address that issue.
Can you tell us a bit about what your big, long kind of private stay was like? What was it?
Cambia.
Was it a hospital?
So
was it a lot rehab or a?
It's sort of low secure with lot rehab all in one.
Yeah. Okay.
So you have assessment and then you have continuing care. I mean, when I went and did that, for the first 6 months I was very eager to change, because I'd seen the negatives effects and the decline over time, and it was just getting worse and worse. And for the first 6 months it was alright, but once you've been detained for longer than 6 months and you don't clearly understand why these people are taking your freedom away, once you then hit the year stone and then you hit the year and a half, I gave up hope of ever seeing the free world again. I mean, now looking back, it was only a short 2 years. I mean,
quite a long time.
2 years is
a young life.
I know, but at the time it felt like a millennium,
and
I didn't see it an end. And in the end of that, I came so hard to handle and so pushing against the system that they just said, right, go. I realised that coming to a short like that wasn't good, because then when I went, it got even worse, the incidents, and I ended up nearly losing my life, and I lost half my right arm, and then that's when I lost my career as well as a chef. So
it got way more chaotic.
So
did you not were there any good bits from, once you'd come out of your long stay, did you have any calmer bits, or was it all chaos from there?
I hit the road 100 mile an hour going. I still had substance and alcohol misuse problems, drastic ones, and that's just what I fell back into. I'd felt like I'd missed 2 years and I was trying to catch myself up, and it ended in tragedy. And when the doctor come up and I knew that's it, another long section, we made a deal that I'd get to go on one holiday, I'd get to shut my affairs down, and I'd go wherever they sent me, and that's how I ended up in this area. It was really good stuff. My key worker there was amazing. When I got there, I had crippling social anxiety that I couldn't go on the front to smoke a cigarette, and she worked with me for a very long time. She knows who she is, and I'm very, very grateful for her. But I do believe, you're only as good as the staff you employ. And when I was there, luckily there was some very good staff. I'd had all these admissions, all these different stays as an inpatient, but never had the label of the ASD. And quite frankly, I didn't want it. And I got the diagnosis. So then, when I went into the social housing and things started to decline quickly again, when I then get detained, we triggered the CTRs, and so I think something like 34, 36 acute admissions since 15, and then the long ones and the open ones. It's a good bit of your life, but in my opinion, because we didn't have the service of the community treatment review, the reason why we're here today, and the amount of time, although they've been longer admissions, I'm not in out, and then I've been placed in somewhere that's suitable because of having all them disciplines together in a community treatment review.
Okay. So I think that'd be really good then to talk about, because you've had two, so that makes it a really honest conversation as well, because the first one, obviously, everything didn't turn out perfect because you went back in, and I don't think we've ever got an expectation that, anyone's on a quick fix here. You've had quite a long journey to get to where you are with lots of experience.
You're not going to change that in one.
No, we're trying to learn. We need to do these things with people, don't we?
But the first one that I'd ever had, I didn't understand why I was having it, why I needed it, what it was for. I didn't really follow up with it or anything. It was only the second time when I knew it was coming around again that I realised that it was an opportunity to actually put forward and be honest and move forward. And I've kind of at that point accepted that I did want better out of things, that I didn't want this to trail me around for the next 36 admissions. I didn't want that, because as good as my body has been at healing, there's only one point where it catches up with you.
So is it easy for you to remember the second CTR if we're to look at
the second one's a lot better.
So if we talk about that care and treatment review, it might be useful for people to know sort of how that ran for you. So did people prepare you for it? Did they tell you what was going to happen?
I'd had the CTR the year before, and so I knew the process. I knew what would happen. I seen your name. I knew you was coming, and like I say, I'm a true believer in the expert by experience role.
You'd found that quite powerful at your previous CTR.
Yeah, and it sort of gave me something to look up to sort of focus on, to think, you know what, I want to be at that position in my life. And when anybody said, well, you're more than capable, it's stability for sustainability, and I still don't think I'm there yet. But
so did it matter to you that someone was on your review who'd had experiences?
100%, yeah. Because it's third party impartial there.
Yeah.
One that it is possible to get to a point.
Yeah, so there's sort of role modelling as well as
but
in Derbyshire we're not viewing that just getting this right for people with autism or learning disabilities is going to be enough.
I agree.
We're viewing that they're a chance to have a look at what we're doing with mental health care altogether, and sort of start to have a look at how we can change that altogether for everybody, because otherwise it's not going to
I don't know what the rest of your role in your career is, but if you had just going to CTRs every day of the week, I don't know whether I don't know whether you get fed up with it, but no, I think everybody should get afforded the chance. I mean, with dual diagnosis, it's every time of admittance. I've found that every time you get admitted, you will trigger it.
You've got a treatment review within 4 weeks.
Yeah, exactly that. I think that early intervention should have it. I really believe that early intervention should have it. I believe everybody that gets put in is, but I don't know whether
particularly people who, I guess, would you feel that particularly people who are going in and out more,
just the cliche revolving door patient. I think there must be systems where it flag up that Christ, he's been here 3 times this year.
Because you must have had a million meetings in your many years.
In my life,
So what was different about a care and treatment review in terms of kind of how you were treated in it, I suppose?
I mean, as an example, just like as a metaphor, you get spoken to rather than spoken about. That's the main factor. You're the celebrity in that paparazzi frenzy, and ego aside or whatever, that you're the person that knows best. I haven't known best all my life, and this is where it's been so complex over the years, because I still don't know 100%.
It's hard to get it right, because you think, well, the person needs to be at the centre of it, that's no question, because it's your life, even the good and the bad decisions, and also you've been unwell. So it's that combination of trying to ask the right questions to get your views and put you in the centre, but not to necessarily say that you've got all the answers, because if you had all the ansers, we're aware that you wouldn't necessarily be where you are. So did you feel like that was right in terms of you being listened to, but also everything you said being...
Because it can be very distressing as well to hear everything. You know, you don't need to know every nitty gritty. I mean, part of you always wants to. It's always difficult when you know somebody's speaking about you and you're not involved in that. But some things, would just distress your life more if you knew about. And the way that CTRs are put together, my last one, we must have had 8 different
Did you stay for your whole thing with everybody coming in and out, or did you?
No, I couldn't do that.
Did you leave bits? Because you can stay.
I know I could. I let everybody have their limelight. You know what I mean?
Did you?
Not limelight. I let everyone put their 2 pence in, because as a collaboration, as an orchestra, you know, as a symphony, everybody.
So what did you do? Did you come in first?
I came in first, yeah.
Tell us how it is.
And then I sort of orchestrated everyone before they went in as what I would like from that particular person, what I would like their input to emphasise, and then also sort of giving the wink and nod, please put your bit in, because you know you're a professional as well. You have got to respect these people that have trained all their life to be in this. So I'd sort of worked it out on the first one, and I was ready and primed
to make it work for you.
Yeah, because I wasn't happy in the life, and I knew carrying on down that road wouldn't be a life if I had a life left at all. So I was very keen to make that work and to get the most out of it, because I didn't want to have to go into hospital again to trigger another one, or to go through, because it is quite an exhausting process as well.
Remind me, was your housing situation affecting your mental health when you came to this last time?
It has. I think this is where I live now is my 9th area of living.
Yeah.
And no two have ever been the same lifestyle.
How did they decide this? You know,
well, I saw. If you remember, you was quite clear that there was to give me 3 options on this one.
Okay, you remember better than me, see. Then I fall foul of remembering every detail. I feel
no,
bad.
It's okay. It was reiterated by everybody that supported living was the case. You know, not back into the days where, you know, every whim somebody at your door every 15 minutes. You know, I think it was mentioned in the CTR by a lot of people that allowing me to help others allows me to help myself, and in the environment that I was in, I wasn't able to do that. So to move to an environment, like I say, I'm going, hopefully starting at the hospice soon and going working with
you've got
palliative
masses
care.
to give, haven't you, Tom?
I'd hoped so, otherwise it's all been a big waste. And I put myself down, and I can't function properly until I feel like I'm contributing as well, because this whole video has been about how much I've been received over my life, and that I'm very conscious of that. There's so many people, so many services have put into me, and then when you feel that you can't put back out to somebody else, to me personally, it just stops me functioning. What
are the bits today that are kind of working for you? If we did a CTR today,
if we did
what's working, what's not working, what's working at the moment?
To be honest, it's a really deep question that I can't answer. My friends and family were all saying to me once I'd moved out of this stay in hospital and I come here, that how well I was doing and how differently I was approaching things, and one of my best friends said forward thinking, and I kept saying, well, look, I can't see a difference, I can't notice anything different that I'm doing now that I wasn't doing, and they were like, well, we can.
Right.
So unfortunately I can't self-assess that good.
No, but you have changed, and keeping you there are the relationships you've got with, I don't know what it's like here, and I don't know what it's like in terms of you seeing your CPN and your social worker, but has that continued? Have you got a support system around you?
Yeah, of course. I don't like going into individual placements and nicking, picking and adding a personal view on that, because, you know, there's good and bad to everything in life. But my social circle, you know, it's very small, but helps me a hell of a lot. My professional circle, social work was here yesterday. My CPN will probably barge through that door in a minute because we're taking hours to make the video. But no, but I've tend to find that I've been able to free their time up for others as well, without
so they're not needing to do as much as they have in the past, but they're keeping an eye on it.
Yeah, of course. I still have what I feel the same amount of support.
Okay.
But I'm a true believer that you have your piece of your pie, and you don't take somebody else's piece. You have your piece, and your piece might be larger at times and smaller. Mine's smaller now. And you know how the books are filled with these people. They're running ragged and they do a great job.
When I did your CTR, both times actually, your potential is so obvious, Tom. So I can only imagine what it will have been like to be your CPN and your social worker, people who've really kind of cared about you along the way, because they will have also been able to see that potential. But in the meantime, are constantly trying to stop you from trying to stop you from really, really hurting yourself and get to the bit where you get to live your life. So I'm hoping that you've started.
Well, I'm hoping to be a long-awaited success story. You know, I think that'll be a proud moment. But again, I won't be able to see it I'll just think I'm plodding along like I've always done, but it's nice to see other people.
Plodding along sounds alright though.
Yeah,
You haven't always plodded, have you?
but no, unfortunately I haven't. But I can see what people's reactions are, and I can read reactions very well.
Do you think people have had more empathy for you since your
I don't
diagnosis
really want
moved
empathy.
from, well, not sympathy, I mean understanding? So
Yeah.
did the ASD, the autism diagnosis, help people to understand better than when you had it all?
And when I was first telling people, there were people, no, you're not, we don't believe you. And it was quite a big thing to allow them to read that document. A lot of people had just...
Did you share it with lots of people?
Not lots of people, but for the
Thinking
people
yourself.
that I wanted to understand, like, because I related to it once I read that, and we had a shortened version and a long version, and I still keep a copy with the services just in case I ever need to pull on it. I'll never read it again. I don't want to. I've read it once, and then once they read that, it made sense to them.
And so that has helped a bit.
Yeah,
People have seen it slightly differently.
Once I know that people are here to stay, and that they need to understand these things.
So nobody's removed any of the other diagnoses. You've got them running alongside.
No, I've 3 now. Yeah, I've got a disability, a disorder, and an illness. So, bingo. But yeah, it like we said, sometimes it's not wise to look too much into your diagnosis. They're not really.
Not if you're getting on with living your life.
Yeah, they're for us to know and be aware of, and that's what people think. But I'm done with the days of studying and becoming the perfect schizophrenic or the perfect bipolar. There's a lot of people that believe that them labels should just be for office use only, so to speak, because I don't want to present something I'm not.
And then I guess the last thing to talk about, I think, is the opportunities that face you next, because one of the things you talked about in your character review were the experts by experience, which we've talked about, and your opportunity to perhaps get to do that one day.
That would be an honour if I could ever.
And I feel like that's something that we need to kind of have a look, don't we, and make sure that when those opportunities come up, you need to know where those people get employed in, because you'll be a great expert by experience.
I think a bit more time and a
Who's
bit more
had more
work.
experience than you?
My mum. But no, that'd be great. For the time being, I just want to keep focusing on my medical and keep helping people medically, and then keep my certificates up to date and try and get into palliative care. But yeah, if I could at some point come into CTRs, well, what a moment would that be, eh? Other side of the coin.